the representative of the Prime Minister, the representative of the Minister of Health, Honorable Jume Peter, Head of Parliamentary Caucus for Health Financing, the representative of WHO Country Office, the President of the Organizing Committee, Mr. Ferdinand Benzumi, the President of the Scientific Committee, Professor Jean-Claude Tumanya, members, esteemed international experts and partners, distinguished parliamentarians, senior government officials, academia, my civil society colleagues, people living with non-communicable diseases, ladies and gentlemen. It is with profound humility and immense joy that I stand before you this morning as chairman of the Board of Reconciliation and Development Association, RADA. RADA is a community development organization registered in 2017 with a vision to see communities in which individuals live harmoniously and peacefully, harnessing their full potential to support sustainable development, growth, prosperity, health, and well-being for all. Since 2020, RADA has walked the difficult yet necessary path of principled, focused, and evidence-driven advocacy for population-based NCD prevention. As an ENT surgeon who has spent over 17 years in operating theaters in Cameroon, Africa, and the US, I have witnessed firsthand the devastating human cost of diet-related non-communicable diseases, the silent progression of hypertension, cancers in its various forms, diabetes, cardiovascular complications that now claim 43% of all deaths in our nation. Yet, as a medical personnel, I know the power of policy that can stop or delay people from even coming to the hospital in the first place. While we know that what is pushing people into the river upstream is important for us than to build bridges and stop the fall rather than being contended with trying to resuscitate those who have fallen into the river. In other words, like we say, prevention is better than cure. RADA is not contented with clinical care alone. We choose the hard road of upstream prevention, championing best practice policies like front of pack warning label for unhealthy foods, marketing restrictions on unhealthy foods, especially to children, and tax measures that make healthy choices the easy choices. In 2021, our organization started with rigorous evidence generation and, true to our principle, engaged with relevant stakeholders and upheld the necessary strategic partnership with the Ministry of Public Health, WHO, academia, and global allies to demonstrate that these two policies we shall be discussing in this program are not only life-saving but economically transformative to the nation. We have reached the reality of unhealthy foods in Cameroon. The potential for intervention, the gains that will be made in healthy life years for health taxes on sweetened beverages and ultra-processed food. And as you will hear from different expert speakers, the evidence of the benefits of action speak for itself. All we need is the pen of the policymakers and continued collaboration for everyone. That is why we have brought all of us here, thanks to the sacrificial and yet generous support of our partners, resolved to save lives and global health advocacy incubator. The representative of the Prime Minister, sir, distinguished guests, ladies and gentlemen, the first symposium and roundtable is focused on the first major risk factor of NCDs in Cameroon, namely unhealthy diets. Unhealthy diets have taken over tobacco since 2016 as the first major risk factor for developing non-communicable disease. This first symposium, which is a culmination of years of quiet, determined work by Radar and his partners to place Cameroon at the forefront of NCD leadership in Africa, is therefore an opportunity for our decision makers to now come together in one understanding, and through the input of each, accelerate the formalization of key policies that will flag Cameroon as a country that is serious with the health of its population, and that can attain important state goals for health with the support of all sectors of government and society, ministers, parliamentarians, global experts, frontline voices. Honorable guests, the eyes of the nation and indeed the continent are upon us. When evidence meets political will, policy action should follow. Let this historic gathering produce not only understanding across ministries and different stakeholders in Cameroon, but a clear, bold, actionable 2026 Cameroon NCDs and nutrition policy action roadmap that future generations will point to us with pride as a result of each sector's contribution to the health of the population and the nation at large. On behalf of the board, the executive and the entire Radar staff family, I warmly welcome you all. May the next 2 days be fruitful, and may the outcome honor the trust placed upon us. Thank you very much.